health groups are pushing back against a recent decision by the CDC's Vaccine Advisory Committee.
The committee has voted now to change federal recommendations for the hepatitis vaccine. News Center Maine's Christian Harsa spoke with medical experts about the directive now and why they're speaking up.
It is finals week at the University of New England's Portland campus for the health sciences.
Our curriculum is team taught.
Dr. Jean Carrero is the dean of the College of Osteopathic Medicine.
It's about solving the problem for the patient. So how do you work with a patient?
Dr. Carrero was training in New York in 1991 when the hepatitis B vaccine was first recommended for all newborn babies.
And now, the decrease is it was a 99% decrease in the incidence of infections.
More than 30 years later, the CDC's Vaccine Advisory Committee recommended changing the universal recommendation on Friday.
No conflict of interest, vote yes.
The panel, newly installed by Health and Human Services Secretary Robert F. Kennedy Jr., voted 8-3 to remove the universal recommendation, limiting it only to babies whose mothers tested positive or whose status is unknown. The panel also voted 6-4 to no longer recommend the full 3 doses that have been standard since '91.
If you have symptomatic hepatitis in the moment,
Dr. Catherine Brandt says when hepatitis does show up, it creates fatigue, nausea, and jaundice.
And unfortunately, the most common way that it shows up is that it doesn't show up until you develop liver failure.
Dr. Brandt is also the president of the Maine Osteopathic Association. MOA, the Maine Medical Association, and these other groups all signed a letter Friday decrying the CDC advisory panel's decision. That list included the Maine Academy of Physician Associates.
I think this new recommendation could place really one of our most vulnerable populations at unnecessary risk.
President Donald Trump, on the other hand, applauding the vote on Truth Social.
I don't even know where to begin. It's so damaging.
Despite changing directives, on Maine's only med campus, the curriculum isn't changing.
The science hasn't changed. The science is the science.
And for those with questions, Dr. Carrera says your doctor is the best resource. Christian Harsa, News Center, Maine.
The CDC's Vaccine Advisory Panel's recommendation is now awaiting approval from the acting director. Once approved, the changes to the universal hepatitis B vaccine recommendation would go into effect.